Morning, everyone. So today in this class, we are going to learn about management of breast cancer and leukemia. So in the last class, we have seen regarding chemotherapy, chemotherapeutic agents, and matter regarding chemotherapy. So in this class, let's deal about breast cancer and leukemia. So breast cancer etiology. Mainly, the breast cancer is caused by genetic mutations like genes like BRCA1 and BRCA2 are the reasons for this breast cancer. And the hormonal factors like estrogen exposure and family history, genes, radiation exposure, and also some lifestyle factors like obesity, alcohol, and a lack of exercise can lead to this breast cancer. And epidemiology involves it is mainly most common cancer in women worldwide. So it is commonly occur in women worldwide, and it is the second leading cause of cancer related death in women. And it is mainly occurs mostly in menopausal women of 50 to 70 years of age. And increasing incidence is younger women due to some lifestyle changes. It has been increasing in young women also. And pathophysiology, the breast cancer mainly begins in epithelial cell linings or ducts and are lobules of the breast. And the mutation in DNA can lead to uncontrolled cell division and can cause and lymphatic or blood vessels to lymph nodes, bones, lungs, liver, and brain. The diagnosis involves mainly clinical breast exam is done and also mammography is done. Mammography means nothing but it is a specialized medical imaging technique which uses low dose X-rays for examining the breast tissue, and it is primarily used to detect the early signs of breast cancer. There will be two types of mammographies will be there, that is a screening mammography and diagnosing mammography. And also ultrasound test and MRI scanning can be performed, and biopsy can be done by using some core needles or fine needles or surgical needles. So biopsy is nothing but taking a small sample of breast tissue. It will be removed and examined under microscope. And hormonal receptor testing is also done. Hormonal receptor testing is a lab test which is performed on breast cancer tissue, which involves ER. ER means estrogen receptor test, and PR means nothing but progesterone receptor test. HER2 is nothing but it is a protein which promotes the cell growth. This HER2 positive cancers will have too much of this HER2 protein, which leads to faster growth and spread of cancer cells. And next one, staging. Staging is nothing but TNF classification, which is developed mainly by American Joint Committee on Cancer. The Union of International Cancer Control combinedly have developed this TNM classification, which involves T means tumor size and extent, N means the involvement of nodes, M means metastasis. Metastasis means nothing but how much amount of cancer has spread to the other parts of the body. That comes under TNM. And symptoms of breast cancer mainly involves Symptoms of breast cancer mainly involves the lump in the breast or armpit, and the change in size or shape of the breast, and the nipple discharge or inversion of the nipple, and skin changes which may be dimpling or redness at the spot, and pain in the latter stages of cancer. These are the symptoms which are involved in breast cancer. And when it comes to pharmacological treatment, mainly the chemotherapy is done by using doxorubicin, cyclophosphamide, paclitaxel. And hormonal therapy can be done by using tamoxifen and anastrozole. And targeted therapy can be done by using drugs like trastuzumab, lepatinib. And immunotherapy can be done by atezolizumab. And bisphosphonates for bone metastasis can be given. Next, non-pharmacological treatment mainly involves surgery, radiation therapy, lifestyle changes, and psychological support and rehabilitation therapy. Next, leukemia. So leukemia is also mainly caused by genetic mutations and radiation exposure, and chemotherapy of other cancers can also lead to leukemia. And also it is caused by viral infections like HTLV1, and it is caused by exposure towards benzene, and also by genetic disorders like Down syndrome. And it is mainly common in children, that is acute lymphoblastic leukemia, that is called as ALL. It is common in children, and chronic lymphocytic leukemia, that is CLL, that is common in elders. And leukemia accounts for about 3% of all cancers, and here male are more affected than females. Pathophysiology of leukemia involves the malignant cells will transform to hematopoietic stem cells and accumulates there and causes blast in bone marrow. And it leads to inhibition of normal hematopoiesis, which leads to anemia, thrombocytopenia, and neutropenia. And it can infiltrate organs like liver, spleen, lymph nodes, and CNS. And the diagnosis mainly involves complete blood count for knowing anemia, leukopenia, or thrombocytopenia, and peripheral smear test is performed in the presence of blast cells, and bone marrow biopsy can be done, cytogenetics can be done, and flow cytometry has to be known, and a lumbar puncture can be known for checking CNS involvement. And symptoms of leukemia mainly involves fatigue, weakness, fever and infections, and bleeding, bone and joint pain, and the lymph nodes swelling, weight loss, and sweats during night, and hepatosplenomegaly. These are the some of the symptoms which will occur during leukemia. Next, pharmacological treatment mainly involves chemotherapy. Chemotherapy is done mainly by the drugs like cytarabine, daunorubicin, methotrexate, vincristine. And targeted therapy can be done by using drugs like imatinib, dasatinib. And immunotherapy can be done by using drugs like blinatumomab, CAR T cell therapy. And steroids like prednisone and dexamethasone can be given in ALL, and growth factors like GCSF is used for stimulating the white cells, and antibiotics are mainly given for controlling infection, and some cases bone marrow transplantation can be done. And non-pharmacological treatment mainly involves bone marrow transplantation, radiation therapy, nutritional support, psychological support, infection control, and blood transfusion in severe blood loss cases, and hygiene education for preventing infections. And next one is management of chemotherapy induced nausea and vomiting, which is called as CINV. In the name itself it is there. You see, management of chemotherapy induced nausea and vomiting. So during the process of chemotherapy, there is a chance that the patient may get this thing which is called as chemotherapy induced nausea and vomiting. The patient may notice that nausea and vomiting during this chemotherapy process. In the types of these CINV involves first acute, delayed, anticipatory, breakthrough, and refractory. Acute means it occurs within 24 hours of chemotherapy, means after the performing of chemotherapy, then within 24 hours, this nausea and vomiting can be seen in the patient. Such type of NV is known as acute CINV. And next one is delayed. Delayed means after 24 hours of chemotherapy, if the patient experiences this, then it comes under delayed. Next, anticipatory. Anticipatory means nothing but before performing chemotherapy only. Before performing only, if the patient experiences nausea and vomiting, then that will come under anticipatory. Next, breakthrough. Breakthrough means nothing but by giving the treatment using chemotherapy, and also by giving treatment for this emesis, if it again occurs, then will come under breakthrough. Next, refractory means the failure of treatment can also lead to this nausea and vomiting, then that is also comes under refractory. So these are the types of CINV, that is chemotherapy induced nausea and vomiting. The pharmacological management of these includes mainly by using 5-HT3 receptor antagonist like ondansetron, granisetron, palanosetron can be used for treating acute CINV, and MK1 receptor antagonists are given for treating delayed CINV, and corticosteroids can be given in both the cases, and dopamine antagonists like metoclopramide, fluorochlorazine are given during refractory CINV, and benzodiazepines like lorazepam can be given during anticipatory CINV, and cannabinoids like nabilone, dronabinol can be given in the cases of refractory CINV, and olanzapine is a given during multiple types of CINV. And this olanzapine is an antipsychotic drug. Next, recommended regimens mainly involves in the case of high emetogenic chemotherapy, means high emesis cases, in the day 1, NK1 antagonist with 5-HT3 antagonist with dexamethasone with olanzapine can be given in the day 1. And day 2 and 4, dexamethasone with or without olanzapine and with or without epipetant can be given in day 2 and 4. And moderately emetogenic chemotherapy involves 5-HT3 antagonist with dexamethasone with or without NK1 antagonist will be given. And in the low emetogenic chemotherapy, dexamethasone or metoclopramide alone will be given before chemotherapy. Means either dexamethasone are given or metoclopramide is given before performing chemotherapy. Next, non-pharmacological management mainly involves diet changes like giving small meals and giving frequent meals, avoiding spicy foods, and cool and room temperatures can be considered for the patient. Next, hydration, and by giving psychological support and by performing acupuncture and acupressure, and by giving some ginger can help to reduce the nausea in the patients. So this is the about management of chemotherapy induced nausea and vomiting. Totally, this is about management of cancers like breast cancer, leukemia, and management of chemotherapy induced nausea and vomiting. Thank you. Jai Hind.